Hello, everyone. I'm Jessica Vanderkolk. I am the communications manager for the city of Battle Creek and one of the 3 public information officers for our Calhoun County COVID-19 response. We wanted to come to you with a program today, just looking at some updates about the COVID-19 pandemic in our community, as well as what's happening at our local hospitals. So let me introduce you to everyone we have on the call with us today. So I have fellow public information officers, Lucy Blair from Calhoun County and Victor Jovanovich from the Calhoun County Public Health Department. We have our Calhoun County Public Health Department Health Officer, Eric Pessel. We have Dr. William Nettleton, who is our Public Health Department Medical Director. And joining us today, we have Dr. Summer Liston Crandall. She is the Chief Medical Officer at Oaklawn Hospital. And we have Dorothy Malcolm, who is the Vice President of Patient Care Services and Chief Nursing Officer at Bronson Battle Creek. So welcome, everyone. What we're going to do is some back and forth. We have a lot of questions and topics to cover that we think will be really informative for everybody. And so Victor is going to kick us off today. So take it away, Victor.
Thanks, Jessica. So I just wanted to start off with like a bit of a question about our hospital systems and what we are seeing in Calhoun County and what kind of demographic that we're seeing enter into the hospital beds, and are we seeing a difference between the vaccinated and unvaccinated in our county? And maybe this might be a good question for Dr. Liston Crandall to start off with.
Yes, well, thank you. So I'm speaking from Oaklawn here in Marshall, where we're having our highest rates of admissions and COVID-related deaths of any time in the pandemic. On Monday, and again yesterday, we reached 20 inpatients for the first time. We only have a total of 50 beds for our ICU and medical units. So most of our beds are being taken up, or a large fraction are being taken up by COVID. Many of our admitted patients are middle-aged, and about 80% are not vaccinated. We do see that younger patients who are unvaccinated are taking up a larger portion of our COVID census. We're also seeing a high number of ill patients without COVID. And with our hospital beds at or near capacity, and with local hospitals struggling like we are, we often find ourselves unable to get our patients transferred. We've been holding seriously ill and critically ill patients here in our emergency department while they await beds.
And we just seen recently in your guys' press release, orange and red status. Can you explain what that means to the average person that may not know what the orange and red status means?
Sure. Are you talking? I didn't hear you, Victor. Sorry.
Yeah, you could go ahead and start off with that, Dorothy.
So, as of yesterday, Bronson Battle Creek elevated to a level orange status due to our high volume of COVID positive patients, along with other non-COVID acute illnesses and staff shortages. Very similar to what Summer just talked about. So what that means is that Bronson healthcare facilities are at capacity consistently, and resources are very limited. And then during this level orange status, we prioritize the care for our pandemic-related and urgent care patients, urgent and emergent. But some of those non-urgent cases and care could be rescheduled or delayed during this time. And so we also have in that orange status, the amount of documentation that nurses are required to do is scaled back, and really trying to reduce their documentation time and give them more time at the bedside, along with nurse-patient ratios are adjusted. They're not our normal, right? We're not in a normal time. And so nurses are seeing their staffing ratios increase. And so we continue to look at that, but more patients may be assigned to them than normally. And so I just want to really take a minute to thank all of the nurses, all of the team at Battle Creek, along with our Calhoun County healthcare folks, to just say thanks for showing up every day. Thanks for being there for our patients. And during these pandemic times, it's really tough. So thank you.
Thank you, Dorothy. I just want to follow up with Dr. Linston real quick. What does this mean for like the general public at this current level that we're at for the hospital systems?
So
If someone wanted to come get care from Oaklawn Hospital.
Dorothy may be the better one to answer just from a contextual standpoint, because we're not using orange or red. I can speak to what sort of changes we've made here. So our surgical cases here at Oaklawn have been on a case-by-case basis. We're primarily limited by having physical hospital beds to care for patients post-operatively. So we've had to cancel some cases just due to not having enough beds. And then we are able to continue most of our outpatient surgeries still, but we know that there may be a time coming soon that all elective surgeries will have to be put off, much like we hear at our neighbors. In terms of our outpatient care, we have asked providers to put off well visits for about 3 months, unless they're children who need to come in for vaccinations. We're putting off routine yearly physicals and yearly well visits for children not requiring immunizations. And then we're also converting a large fraction of our visits to telemedicine to allow us to staff more effectively, because unfortunately we're short-staffed in the office as well as in the hospital.
Thank you. Maybe this is a good question with Eric to start off with, but how do we slow down the sudden surge of these COVID cases in our county, Eric?
Well, actually, Victor, before we jump to that question, I just kind of want to highlight for our community to hear what our hospitals have just said. What is happening in Calhoun County in our hospitals directly affects the health of you and your family. And really the individual decisions that we are making going into the holidays really does not only affect your own health and your families, but really affects the health of the entire community. And what I'm hearing is that, our healthcare workers are tired. We've been at this for a really long time. And what I also hear is that we have a lot more COVID patients and a lot more folks who get sick every day, whether it may be from a heart attack, where it may be for a lung problem. We still got to be able to take care of those folks too. But we throw COVID-19 on top of it at a time when we have difficulty with healthcare staff being worn out. It makes a real strain on our healthcare systems, and this directly affects the health of you and your families. And so I think that's just important context to hear the message that our hospitals are communicating with us today.
Perfect. Thank you, Dr. Nettleton. Just to follow up with the last question. So we are seeing a rise in the COVID cases in our community, Calhoun County. What are some measures that we can take, Eric, to slow this sudden surge that we're seeing?
Well, certainly, first of all, I'd like to echo what Dr. Nettleton just said. I think it's pretty clear in listening to our two guests today that this is serious, and we're in a situation where it's affecting all of us. So what are some things we can do? And this is the answer to your question is something that we've been discussing for the longest time now. And I, as we're going into a holiday season, it probably bears for us to say it again. But first and foremost, if you're not vaccinated, please get vaccinated. Now's the time. We don't have to wait any longer. We've seen hundreds of thousands of millions of people getting vaccinated. It's safe, it's effective. Now's the time to get vaccinated. That's number one. Number two, avoid large indoor gatherings. I know we're getting ready for the holiday season, and you have unvaccinated folks there. Try to get a test. Use one of our rapid tests that are out there and available over the counter, and test everybody before we gather. Those are things we can do right away, right now. I think testing more is something that we all need to take part of as we move forward. Masking when we're indoors, of course, we've been talking about this for a long time, and anytime we're in a large group or large gathering indoors, wearing a mask is important. Those are some of the basics that I can think of right off the top of my head. Nothing more important right now, though, than getting vaccinated. Doc, do you have anything to add to that?
Yeah, absolutely. And the time really is now. It takes several weeks for that vaccine to give you some protection. And we're hearing from our hospitals, we go into the holidays, there's already a strain. So getting vaccinated now is it's most important thing that we can do. And in the meantime, use those other strategies of masking indoors, getting tested prior to those social events, getting tested when you are exposed to someone with COVID-19, and especially getting tested if you have symptoms. And if you have symptoms, stay home, don't go to work or school. That's where we see a lot of people getting sick, is when those folks come to school or work while they're infectious.
So one of the viruses that we're having in the variant is the Delta variant. Are there any other concerns as of right now, Dr. Nettleton, of variants that may be coming into Michigan affecting our community? Or is it just primarily Delta at this point?
It's overwhelmingly Delta right now, and it's nearly twice as infectious as the original strain of the coronavirus. It's just much more infectious, much easier to get infected. And that's why it's spreading so quickly as we're coming inside, as it's getting cold in Michigan. Now, what we are at risk at is that if not enough people are vaccinated, we are at risk for other variants emerging. We've seen that happen in other parts of the world. That's how, well, Delta emerged. So when there is less community immunity, there is more risk for a new variant to emerge and cause additional challenge for our community. So another reason to get vaccinated.
Thank you so much. I'm going to shift gears a little bit, and we'll ask some questions related to vaccination. The Michigan Department of Health and Human Services, MDHHS, announced that Michigan has reached the state's 70% vaccination goal. Does that mean we're done? What is the current vaccination rate for Calhoun County? And maybe I'll give this one to Eric first.
Thanks, Lucy. And if I could first, I'd like to respond to the notification that we received last week that Michigan had reached the initiation of 70%. And I think what's important for the public to know, and you know, doggone it, I wish it would have been explicitly discussed last week, but that 70% number is for those folks age 16 on up. That is not our current population in Michigan and the current coverage. So let's fast forward that to what we see here in Calhoun County. Our current vaccination coverage, and this is fully vaccinated for Calhoun County based on 134,000 Calhoun County citizens, is 45.6%. That's for Calhoun County. In the state of Michigan, it's probably somewhere, I'm going to guess, I hate to guess, but I'm going to say it's probably down around 60 or just below 60% if you take the entire population of Michigan into account. For those of us that are 16 and older in Calhoun County, our fully completed vaccination status of 16 and older is about approximately 55% of our citizens of that age. And our 5 to 11-year-olds, which just became available a couple of weeks ago, we're at a 7.8% initiation of our 5 to 11-year-olds.
Great, thank you. That's important information. Does anyone have anything else that they'd like to add about you know, the levels of vaccine here in Michigan?
Well, I think it's important to note, you know, I hear a lot, well, hey, you know, we have all these folks vaccinated and yet we're still having, you know, this surge in Michigan. What's going on there? And it does remain that the majority of cases and those who are hospitalized are those who are unvaccinated. So even though we have a proportion of the population vaccinated, we don't have enough. And with the Delta variant, it just gives much more risk for it to spread, particularly amongst those who are unvaccinated, as we are coming indoors as it's getting cold in Michigan.
Great, thank you. The Pfizer vaccine is now available for folks 5 to 11 years of age. Why is it important for children to get vaccinated? And what risk do they have if they don't get vaccinated for COVID-19? Let's have Dr. Nettleton respond to this one.
I saw Dr. Liston. She was ready to chime in.
Yeah, there we go.
I'm ready.
Go for it. I would love that.
So,
Thank you.
as the mom of 2 children in this group, I can enthusiastically speak to the safety and efficacy of the vaccine. They were, nearly first in line to get theirs. So, thankfully, children rarely get ill enough from COVID to require hospitalization, and very few have died. But children 10 to 19 are the fastest growing group of new infections. They miss school, their parents miss work, and then they spread it, unfortunately, to adults who are more frail or under-vaccinated. By under-vaccinated, I mean underprotected by their previous vaccination series if they've received it. The sooner that we achieve herd immunity in this age group, the sooner that we can slow the pandemic.
And I agree fully with Dr. Liston Crandall. So as a family doctor, I recommend to my patients who are 5 to 11 years old to get the vaccine. And as a parent of a 5-year-old, I've already gotten her vaccinated as well. And so there are a lot of myths about COVID-19 and kids. Kids are affected by COVID-19. They get infected. And as I was pointing out, although it's rare for them to be hospitalized, it has happened. And it's happened in Calhoun County in Southwest Michigan. Although it's very rare for children to die of COVID-19, that too has also happened. We also have children who have what's known as the multi-system inflammatory syndrome. This, after you get COVID, even if it's without symptoms, within a month or so, this inflammation occurs in a child's body, including the child's heart overall. So we should prevent what is preventable and use our vaccine to do so. We've had nearly 3,000 children that were in the study about the 5 to 11-year-old vaccine. And now we've had over 1 million children in the United States be vaccinated with the vaccine too. And as a parent, it's challenging. So there's so much information out there. We want to do what's best for our children. And so, finding those recommended resources. So talk to your family doctor, talk to your pediatrician about concerns you may have about the COVID-19 vaccine and about COVID-19 in general. And I think it's also just important to note about where we are in Calhoun County. Our case rate is so high right now that there's going to be even more benefit for receiving the vaccine now, given that there is so much virus circulating in the community.
Great, thank you very much. So moving on to some recent news that we put out this week or recently about booster shots being available for all adults age 18 and older. I'm interested in your message for folks who are eligible now for the booster dose. What would your message to them be? Just you recommend the booster for everyone? Please share some information about that. Do we want to start with Dorothy on this one?
Sure. I would say get your booster. We need people to get vaccinated and get their booster. We have boosters available. I'm assuming at both hospitals within our systems. I don't want to speak for Dr. Liston Crandall, but I'm sure that we do across the county have those available. We do here at Bronson. So if you're 6 months out from your initial 2 shots, then your second shot, then you should definitely get your booster.
Anything else anyone would add?
I do need to speak to that because we aren't able to offer boosters to patients without other risk factors, just because we are so limited in the staff available to administer vaccines. So we're encouraging people to look to the health department, look to the local pharmacies, look to our neighbors at Bronson, Battle Creek to get their boosters. But I think that given the fact that the vaccination is only so protective, we are seeing breakthrough cases. Thankfully, by and large, they're less severe and require hospitalization and cause death on a much less frequent basis than in patients who are not vaccinated. But why not boost your protection as possible, especially if you work in public and especially if you yourself have any serious health conditions or if your family members do. Just put another layer of protection.
Yes, and I agree. There's particular benefit for those who are over the age of 65, those who are over the age of 50 of underlying medical conditions, those who are exposed often to folks in public, whether you're working face-to-face or in whatever job that may be. So I know it may be confusing to people to say, well, I heard they were so good and now you're all telling me to get a booster. What's that all about? And does that say that the vaccine doesn't work? And that's not true. That's what I hear a lot. And this, when you think about this, is about levels of risk. And risk is on a basis of a continuum. It's not yes, no, black, white, works, doesn't work. For COVID-19 vaccines, they are very good at preventing severe disease, hospitalization, and death. We've learned that over time, however, particularly those who are older or have underlying medical conditions, it may have less protection for those who are looking to prevent infection in general. And so that was a primary reason to get a booster, is to give you that additional layer of protection from getting infected in general. And for those who are particularly older or underlying medical conditions, to get that extra protection from severe disease as well. And so it is the right time to also get the booster, again, because of how high our case rates are in Calhoun County.
Perfect. Thank you very much. Changing gears just a tiny bit, the Pfizer antiviral pill we've heard is highly effective in treating COVID. Do we have a timeline for when the antiviral pill will be made available? And, tell us a little bit about how we should think about the antiviral pill, with when we're also thinking about vaccine and things like that. I would imagine we don't want people to wait for that instead of the vaccine, but I definitely am interested in how we start thinking about things like an antiviral pill. Who would like to talk on this one?
I can touch on that a little
Sure,
bit.
yeah,
And
please.
so the Food and Drug Administration will be discussing this on November 30th. And so the public at that time will be able to see the actual data that Pfizer, and there's another company as well, Merck, that will be presenting additional data, probably at a different meeting. So physicians and scientists can publicly review the data and see about what has been reported, which has been very encouraging thus far. A way to reduce what's known as the morbidity, or how much it affects you and causes severe disease. But as you've already kind of alluded to, Lucy, it will be an important tool in our toolbox, but it's still going to require a physician assessment, a physician prescription. And the best thing we can do, in addition to that, is prevent the person from getting infected in the first place. And as I mentioned already, the COVID-19 vaccine is very good at preventing severe disease, hospitalization, and death. And that's just another reason for another tool we have in our toolbox for when these pills become available. But the primary way to prevent coronavirus should remain the vaccine.
Great, that's really helpful. Any other thoughts about the antiviral pill that you'd like to share? Anyone else? Okay. Well, I think we can move on to the next set of questions.
Excellent. Thanks, Lucy. So kind of along the same lines of things that people are seeing that they might have questions about, and perhaps I will ask Dr. Liston Crandall to answer this one first, is to talk about what a monoclonal antibody is, if that is FDA approved to treat COVID-19, and where infusion treatments might be available. What your thoughts are on that possibility.
We're spending a lot of time and resources in using monoclonal antibodies to try to prevent hospitalization and death. So monoclonal antibody therapy is receiving an infusion either through an IV or by shots of antibodies made in the lab that can interfere with the coronavirus's ability to attack your body. They've been shown to reduce the risk of death and hospitalization. They're authorized, though not formally FDA approved, so they have an emergency use authorization to treat COVID-19 in patients with risk factors who are not requiring hospitalization. They're available with a doctor's order at different infusion centers. And because of our rates rising so high, we have providers in our health system and throughout the county and the region seeking out extra antibody infusion sites. We've maxed out our availability here at Oaklawn, and unfortunately, we are having to turn some patients away. So this is one more plug. If you don't become infected, then you don't need the antibody therapy, and the antibody therapy can go to another patient who does. So please do ask your provider about antibody therapy, because we know that it can limit your risk of getting seriously ill, but also understand that we need that layer of protection before that layer of protection being vaccination and making, choices to be more socially distanced, more masked, and more protected from illness.
Thank you. Dorothy, do you have information on that from Bronson?
I do a little bit. I would just say that, everyone, I would reiterate exactly what Dr. Liston Crandall said. But again, using your primary care provider to coordinate that, because not every person is a candidate for the monoclonal antibody, but we do have infusion centers and ability to do that both here in Battle Creek and in Kalamazoo at Bronson. So thank you.
Excellent. Thank you. Dr. Nettleton, is there anything you want to add on that topic?
I would just say talk to your doctor to see if you are eligible to receive the monoclonal antibody treatment. It's most effective the sooner you give it, within the first 10 days of your infection.
Great. Thank you all. Now, I know we've talked a little bit about this already, but I think it bears repeating that we are in the holiday season right now, and we would expect families to come together to celebrate, as they often do. Can we go over again some of the safety measures that everyone should be taking to keep themselves and their families and their community safe? Let's see, Eric, you talked a little bit about that. Do you want to take that one?
Doc, why don't you go first on this?
Sure. I know it seems like we're a broken record, but it is just so important to get vaccinated. Avoid those large indoor gatherings. If you're going to gather, and we are going to gather, you're going to be more safe when you have gatherings with fully vaccinated individuals. If you have unvaccinated individuals coming together, consider implementing testing before that event. Get tested before your social event. Anytime you're exposed to coronavirus, you should get tested 3 to 5 days after that exposure. Anytime you have symptoms of COVID-19, you should get tested as well. These are the tools that we have in our toolbox overall, in addition to wearing masks while you are indoors.
Yeah, if I could just, come on top of that as well. And we've heard a lot about, and then we've seen it on advertisements, maybe the CDC or the state of Michigan talks about the wearing of masks. And we know that, and just in general, it's going to be difficult for people that want to wear a mask in their family gatherings when it's your family that you're gathering with, but it's not your immediate family. It's family from other households and other areas, maybe around the state or around the country. We understand that. And we understand that in many cases, you're probably going to choose not to wear a mask. But in those cases, please choose to at least test. And then go back to the reiteration of, it is so important for those that are not vaccinated yet. Please talk to your doctor, talk to your provider, talk to a trusted friend, and go get your first shot.
I also wanted to add the importance of flu vaccination too. We haven't said that yet this afternoon, but we are seeing rising cases of flu, and it is safe to receive both a COVID initial vaccine or a COVID booster along with your flu shot, and getting doubly protected will allow us to halt that, because truly our health systems can't handle an assault from influenza on top of COVID. So please get your flu shots as well.
In fact, I'll share that I got my booster and my influenza shot at the same time.
And just to add on to that, thank you, Dr. Liston Crandall, for the reminder of public health and getting your flu shot. We are also currently seeing some outbreaks, general outbreaks around the state of Michigan. Both the University of Michigan and Michigan State University are both reporting influenza outbreaks currently. And so, it's just another reminder, and I think Dr. Liston has said it a couple times, that the hospital is not full with just COVID. There's also other reasons that people are there, and influenza can be one of them. So It's really important. And I know we've talked a lot about vaccine, but we wouldn't be talking about this if it wasn't so important. So please get vaccinated for both.
Thank you all, and thank you for mentioning the flu too, as we are in that season of receiving flu vaccines as well. The last thing that we want to cover is where to get credible information. And certainly everyone on this call is at a place that is a credible resource. We have our websites, which I will list off again for you, and we'll have them appear on the screen. That's calhouncountymi.gov. That's Calhoun County's website, and you can get to all the public health department information about the COVID vaccine. battlecreekmi.gov/coronavirus. And then we've got, Oaklawn and Bronson, which have information as well. The county website links to those. And of course, there is the CDC and the state MDHHS. And I wanted to ask Dr. Nettleton, you've talked about misinformation and making sure you're getting information from credible resources. So could you talk a little bit about that for the audience that is seeing this program?
The United States Surgeon General in the last several weeks has named and identified, as we all know, health misinformation as a public health problem. And it is a public health problem in Calhoun County. And health misinformation most often comes out of folks kind of wanting to help their neighbor, help their family or their friend by providing some information. But oftentimes it may not be credible information or true information. And so when talking with others, when you hear health information and misinformation when it's identified by your physician or public health professional or trusted professional, to be empathetic, to listen, to hear what they're saying, and to not call that person out in a public setting, whether it's on social media or in a public setting, but maybe pull that person aside, listen, have some empathy, and redirect that person to a credible resource and provide some factual information and encourage them to talk to their doctor or public health professional. Because this misinformation about the COVID-19 vaccine, and pick your topic, is affecting the health of individuals, families, and the health of the entire community in Calhoun County. So naming it for what it is important, and addressing it is important as well. So the media, TV stations, radio stations are important partners in identifying and correcting misinformation. Religious leaders are important in identifying misinformation and correcting misinformation. Your doctor and your hospital and your public health department are important partners in identifying misinformation and providing correct information. So it really does take everybody to address this head on.
Thank you very much. Does anybody else want to speak to the misinformation and credible sources issue? Okay, great. Then I am going to go around the screen and give everyone the chance to give some last thoughts, and thank you all for being on our program here today. So why don't we start with Dorothy Malcolm from Bronson Battle Creek. We appreciate you being here. Any last thoughts for the audience?
Thank you, Jessica. I would just say, I think listening to this program and being on this program, get vaccinated. That's really what we need to do. That's what we need to accomplish. Your decision to get vaccinated impacts our entire community, our county, and the whole country. So please, this is the time to get your vaccination. Thank you.
Thank you so much. Dr. Summer Liston Crandall from Oaklawn Hospital, final thoughts?
Yes, and to echo what Dorothy's saying, of course, vaccination is such a key role here. Please recognize that our hospitals and our health systems are doing what we can to take care of the patients we have to care for. So if you can help us out by becoming vaccinated and limiting your risk of getting infected, we really thank you, because our staff, our providers, and our patients really deserve the best we have to offer. So, you know, our staff, our providers, we're stretched too far. And the less that we have to be caring for unvaccinated individuals, the more that we'll have to give to those who are hospitalized with other health conditions, and the more that we can do to advance the health of the community. So please do everything you can.
Thank you so much. And our Calhoun County Public Health Department Medical Director, Dr. William Nettleton, any final thoughts?
Sure. So throughout the pandemic, I think the challenge for us as a country, as a state, as a community has been, who do you trust? We hear from people on TV, we hear from politicians, we hear from pundits, we hear from people on social media, we hear from doctors, we hear from leaders in nonprofit agencies. And there's so much misinformation out there. But what I really encourage our community to hear today, as we enter this holiday season, is that you trust your nurses, you trust your doctors with your own personal health and your families. When you get in a car accident, when you have heart failure, when you're coming in for a wellness checkup. And your nurses and your doctors are asking you to trust us now about our recommendation to get the COVID-19 vaccine, particularly given the state where we are in Calhoun County and our hospital systems. So please consider that and get vaccinated.
Thank you so much. And Eric Pessel, our Public Health Officer for the Calhoun County Public Health Department.
Thanks, Jessica. And I want to thank everybody on the Zoom today for your input and your expertise. It's heartening. It's heartening for me to know that there's so many people out there that are dedicated to responding to this pandemic and continuing to respond to it. That you know, it keeps me going as we go through day after day after day of COVID-19. I think what's most important message that I would like to leave everybody on is when you've heard the word vaccine, you've heard let's get vaccinated, you've heard let's avoid, you know, large indoor gatherings in general, and really, you know, the question I get asked is, you know, what if you could change anything tomorrow, you know, what would you change? And it really is. This is a preventable disease. It's a vaccine preventable. It's preventable. I heard Dr. Liston say 80% of the folks in Oaklawn are unvaccinated. Could you imagine if all those folks were vaccinated? We would have 80% less of the patients currently at Oaklawn. This is what, if I could change anything tomorrow, I would say, you know, we could stop this thing right now if we could get everybody vaccinated. And it's preventable. And every time that I get notified of another death, or every time I'm notified of another case, that's what I think about. This all could be prevented with a simple vaccine. So please listen to what we said, talk to your trusted provider, your doctor, your nurse, and go get vaccinated. Thank you.
Thank you, Eric. And on behalf of myself and Victor and Lucy, our Public Information Officer team, we want to thank all of you again for being on this program with us. And thank you to everyone for watching. Please take care.